Welcome everyone to the 6 months progress report. I would like to present my PhD theme, which is Management of Itching in the Treatment of Chronic Spontaneous Urticaria and Prurigo nodularis. My name is Andrea Lancz, and I'm a first-year PhD student, and I also working as an internist in the Department of Internal Medicine of Markusovsky Hospital in Szombathely. I will make my PhD with the help of Department of Dermatology of Semmelweis University. As you can see, I have a lot of helpers. My vision is that patients with prurigo nodularis or chronic spontaneous urticaria could have a better quality of life. Therefore, my mission is to optimizing the treatment of these diseases. Currently, I have 2 ongoing projects. Both of them are systematic review and meta-analysis. The first one is about comparing the safety and efficacy of biologics in prurigo nodularis. Prurigo nodularis is a chronic skin disease that usually presents as multiple, very intensely itching nodules erupting on the extensor surfaces of the extremities and the trunk. Many associated diseases are now in the background. However, their coexisting or pre-existing role haven't been established. Only estimated prevalence is available, but the real number of the patients are probably higher. There are numerous therapeutic options, but the conventional therapy's effectiveness is questionable, and some of the drugs may cause serious adverse events. In recent years, new biological agents have been developed, and in cases where the conventional therapies are ineffective or poorly tolerated, the use of biological agents has shown promise. So our aim is to identify the best therapy for prurigo nodularis patients. Our clinical question is, what is the safest and most effective therapy in prurigo nodularis? Using the PICO framework, our populations are patients suffering from prurigo nodularis, and we would like to compare the biological therapies to the conventional therapies or placebo. We will observe the efficacy outcomes and the adverse events. Our hypothesis is that biologics are more effective and safer compared to the conventional therapies. We have carried out a systematic search on the 20th of November with these 2 domains. The first one is about prurigo, and the second one is about all the existing and under development treatment. With this search key, we have found almost 5,000 results, and after the selection protocol, we had 168 eligible articles. Here you can see the list of our ongoing and finished analysis. We have a total of 7 kinds of outcomes. Now let me show my results. Dupilumab is the first FDA-approved treatment for prurigo nodularis. And in my first forest plot, I would like to show the effectiveness of dupilumab of the itch. Our outcome parameters were the itch scales, which ranges 0 to 10. 0 means no itching, and 10 means worst itch imaginable in every itch scale. In the beginning of the studies, the average score of the itch of the patients were between 8 to 10, which is very high. We have selected a total of 6 studies with 216 patients. 2 of the studies are RCT, 1 of them are prospective, and 3 of them are retrospective observational study. The heterogeneity is 8%, which is low. We have compared to the mean of the itch scores from the baseline to the follow-up means, and we have calculated raw mean. As you can see, after dupilumab treatment, the overall itch score decreased almost 6 points, which is a clinically and also a statistically significant result. It means that the pruritus reduced more than 50%, so dupilumab is a highly effective therapy. In my second forest plot, I would like to show the effectiveness of dupilumab of the patient's quality of life. Our outcome parameter were the Dermatology Life Quality Index, which consists of 10 questions concerning the patient's perspective on the impact of their skin disease, of their health-related quality of life over the last week. It is a scale ranges 0 to 30, and higher score means worse quality of life. In the beginning of the studies, the average DLQI score were between 14 and 21. We have selected for the analysis to the same studies with the same population as the previous one, and the heterogeneity is 0%. We have compared to the mean of the baseline DLQI value to the follow-up means, and we have calculated REV mean too. And after dupilumab treatment, the overall DLQI value decreased almost 13 points, which is also a clinically and a statistically significant result. So treating with dupilumab, the prurigo nodularis patients improves the quality of life too. After our results, I would like to summarize our strengths and limitations. First, I would like to highlight the strengths. This will be the first meta-analysis in this topic. It will be a comprehensive analysis of all the existing therapies, and we will investigate a wide range of outcomes. We have some limitations as well. First of all, the studies are very heterogeneous. We have small sample sizes, and unfortunately, many of the studies, there are different definitions of the outcomes. The conclusion based on our preliminary results that dupilumab is a highly effective therapy for prurigo nodularis. We suggest the early use of earlier use of dupilumab in the treatment of prurigo nodularis, and in research field there is obvious that we need more RCTs, especially from biologics. Here you can see my progress. I will finish my data extraction in this month. Now let me back to my second topic, which is investigating the safety and efficacy of biologics in chronic spontaneous urticaria. Chronic spontaneous urticaria is defined by the presence of recurrent urticaria or angioedema or both for a period of 6 weeks or longer. It is a self-limited disease in most of the cases. However, patients suffering from this have a low quality of life. The estimated point prevalence is 1%. And the first-line therapy for this disease is the second-generation antihistamines. However, there are patients who have urticaria refractory to this treatment. In these cases, the use of monoclonal targeted antibodies are necessary. Omalizumab is the first FDA-approved therapy for this disease. It targets the free IgE. Also, omalizumab has been an important addition to the therapeutic armamentarium for the management of this disease. There is still a significant percentage of patients who doesn't respond to the combination of omalizumab and antihistamines. With the expanding knowledge of the pathogenesis of the disease, new biological agents are in development, and the preliminary results are promising. So our aim is to find the most effective treatment for chronic spontaneous urticaria. Our clinical question is, what is the safest and most effective therapy in chronic spontaneous urticaria? Using the PICO framework again, our populations are patients suffering from chronic spontaneous urticaria, and we would like to compare the novel biologics to the conventional therapies. We will observe the efficacy outcomes with the urticaria activity score and the adverse events. Our hypothesis is that novel biologics are more effective and non-inferior in safety compared to the conventional therapies. Our clinical implication is to achieve the early use of biologics in the treatment of chronic spontaneous urticaria. We have carried out a preliminary search and found many results. Our topic is feasible, so our next step will be the Prospero registration. So in summary, these are my 2 ongoing projects, and we are hoping to submit these in this year. Thank you for your attention, and let me say goodbye with the quote of Audrey Hepburn: "Nothing is impossible. The word itself says, I'm possible."
Congratulations. I wanted to ask you, what is the current protocol for biologics use in this disease? I mean, do you first need to have failure with a number of conventional treatments and then you're allowed to go to biologics, or how exactly?
Thank you for your question. Dupilumab is an FDA-approved therapy from last year, and we can add to the patient's therapies from moderate to severe prurigo nodularis. So it depends on the stadium, and we could start if the patient's is moderate or severe, have moderate or severe prurigo nodularis. Sorry.
Thank you.
Congratulations to your progress and your nice presentation. I would like to ask that in your second project you mentioned that there's an urticaria activity score. I would like to ask what kind of score or questionnaire is that?
Thank you for your question. It is a score that consists of two kinds of question. One is about the wheals, the number and the severity of the wheals, so present, below 10, between 20 to 15, and above 50. And the second question is about the pruritus. For example, no pruritus, disturbing pruritus, but not disturbed everyday life, or very severe pruritus that disturb the sleep or everyday activities.
Thank you very much.
Thank you.
Congratulations, nice presentation. I would ask regarding to the first project that what are the side effects of dupilumab?
Thank you for your question. According to the studies and case reports and case series, dupilumab is a relatively safe drug. The most common side effects are the injection site reaction, the mild conjunctivitis, and herpes simplex infections.
Thank you.
What can be the connection between these two typical Th2 cytokines and itching?
Well, there are several studies of the pathogenesis of itching, and in cases prurigo nodularis, there is a high possibility that the T helper 2 related the itch. So T helper cells produce these interleukins. So I think that is the efficacy. That is why so good for the dupilumab for this disease.
Is there any effect of the cytokines of the barrier function of the skin?
I think it is, but
They express the lower expression of proteins which are involved in the tight junctions.
oh.
And also nerve ends express receptors for the cytokines. So this can be the major point of mechanism.
Thank you.